From April 5th to April 11th, 6,524 individuals passed away from COVID 19 in the United States. In that same week, 39,703 individuals passed away from unrelated causes. The CDC reports this statistic and every other death related to COVID 19 on their website, Provisional Death Counts for COVID 19 informational page, which is updated on a daily basis. For someone who's used to seeing friends and loved ones on a daily basis during these times, anxiety and feelings of depression can create stress that might be hard to cope with, especially with statistics such as the one we just discussed. When the media is saturated with news outlets that only report deaths related to COVID 19, it might be calming for some people to research deaths and statistics such as this one, deaths overall, compare the two, and try to see how they measure up within the same time frame. The worldwide pandemic of COVID 19 will affect mental health in regard to healthcare workers, non healthcare workers, and there are various interventions we can take to combat this. So, why is mental health important during the COVID 19 epidemic? Guidelines that have been presented to us to keep us safe are disrupting normal social behaviors. So, I'm sure all of you are experiencing that right now. Quarantine, you have to change up your routines a little bit. Risk for mental health issues, not being able to see people, not being able to cope with stress and anxiety the way that you normally do can harm you, can start making you feel depressed or anxious more so than usual, and increased risk for suicide. Not individually, but as a whole, the general populace does have an increased risk of committing suicide during these times. This topic is interesting to me because I am a psych nurse right now who not only teaches about stress, mental health, and anxiety. I see anxiety on a daily basis, most of the time here recently related to this condition. And I myself actually do have challenges that I face from day to day being a healthcare worker in a healthcare facility and setting. We have to take precautions that we normally wouldn't, and it is stressful. I'm also going to include CDC, the VA, and various news outlets to prove my credibility. So my first point is COVID-19 affects healthcare workers' mental health. There are several different ways that happens. Like I said, there are different guidelines that we're following. Healthcare systems are constantly changing and evolving to stay updated as this disease is possibly evolving itself, but also changing. We're learning new things about how it's spread. And that can be a major source of stress for doctors, nurses, people in hospitals, even housekeeping staff, just people that are in facilities where they are exposed on a daily basis. So biosecurity measures could be one way that people are more stressed out than usual. So for COVID-19, the PPE that people have to wear, which is personal protective equipment, is a little bit different because we're not 100% sure what kind of transmission-based disease it is. We're thinking airborne, so an N95 respirator is the best way to protect yourself, and it forms a tight seal. There's actually a picture of it right here. It forms a tight seal on your mouth and nose. So the CDC provides guidance on the use of PPE in their April 3rd, 2020 article using personal protective equipment. And they mention the airtight N95 respirators, goggles that prevent air leakage around the eyes, shoe coverings, gowns, hair coverings, and gloves. So the reasons why that can cause stress is because the skin on the hands and face are very, very sensitive, and it can start to cause a breakdown quicker than you realize. Until you start wearing it every day, day in and day out, you start to get a rash or skin breakdown on the bridge of your nose, behind your ears from the mask strings, and definitely on the hands from gloves and constant hand washing. The CDC also states in their Symptoms of Coronavirus informational page, which was published March 20th, 2020, that COVID-19 symptoms might be absent or completely or mild for 2 to 14 days after exposure. And if they are mild, they are very similar to flu-like symptoms. So this can actually increase chances of healthcare workers transmitting this disease to their family members who may or may not be immunocompromised. Healthcare workers have families and extended families that they wouldn't want to get sick. Like I said, don't know what their background is or if they're immunocompromised themselves. So that can be a source of stress for healthcare workers. Another cause of stress could be stigma. The VA, in their informational page for managing healthcare workers' stress from April 10th, 2020, states that healthcare workers can be affected by both internal and external stigma. So the stigma may be external from other people shopping for groceries alongside a healthcare worker who maybe hasn't went into work yet. People tend to shy away from you or give you disgusted looks. And that can take a toll on somebody's mental health, definitely, especially if the way that people are reacting to you is outwardly negative. The stigma could also be internal. Healthcare workers are just like anyone else. They have anxiety and stress that they need to get off of their chest, and they might feel a taboo or stigma about speaking out about their own needs or fears. So that could also contribute to their stress. The next point is the novel coronavirus affects the general population mental health. One of the ways that they can be affected is through feelings of fear and guilt. One of the first lessons I personally learned in the world of nursing was that people who are sick tend to be scared. And if their diseases are significant or debilitating or crippling enough, they feel guilty when their family members come to see them or have to help them with things. People, even that aren't sick with COVID-19, are going to be scared because they don't know all the details. They don't know how to protect themselves necessarily, and it can breed feelings of anxiety overwhelmingly so. Published on the Washington Times on March 26, 2020, in their article titled "Mental Health Experts Fear Coronavirus Anxiety May Increase Suicide Risk," journalist Wu-Tan Shen interviewed a professor and vice chair at Emory University, Department of Psychiatry and Behavioral Health Services, Nadine Caslow, and she stated the realities of this epidemic are scary. I think people are under enormous stress. I think there's going to be a lot of loss of loved ones, financial instability, interpersonal conflicts, existing health problems, fears of death, loss. The sense of purpose and feelings of alienation and isolation are all factors that could lead to a potentially higher suicide risk for the general population. And my third reason why the novel coronavirus affects general population's mental health is that societal norms and being isolated away from your family can definitely affect your mental health. So Alex Sawyer of the Washington Times wrote in his article, "Social Distancing Threatens Social Norms and Mental Health," published this on April 3rd, 2020, said the constant reminders that it's not safe to shake hands or come too close to one another isn't healthy, and mental health specialists are warning that these social cues will linger in our minds after the COVID-19 pandemic ends. So Yulia Chentsova-Dutton, who is a cultural psychologist and professor at Georgetown University, states it's hard to go back to more relaxed norms. So being made to stay at home can leave people without their normal stress relievers. So gyms, friends, their family members, concerts, coffee houses, not knowing how to cope or adapt to the altered norms can cause significant distress to your psyche. There are steps that we can take to significantly reduce our stress, anxiety, and mental health issues that might arise from times like this. So general stress reduction tips can be helpful during the pandemic. Healthcare workers and the public in general can benefit from things like this. The stress relievers and things that people do to cope that we mentioned earlier, so going to the gym, coffee houses, seeing friends and family, stuff like that may not be readily available to you right now, but you can use free online workout videos. YouTube's a really great source. Research and experiment with coffee at your house. That could pique the interest of people who like to go to coffee houses and go through different coffees. Social individuals that want to see their friends and family, you can start learning about services like Zoom, FaceTime, Skype. General health measures can be taken too during this time that can help you feel a little bit better. So eating well, getting enough sleep, avoiding tobacco, drugs, alcohol. Try a little bit of meditation. It's beneficial for your psychiatric health and your health in general. Try to keep a positive mindset and remember that this won't last forever. There are individuals that can help individuals that are stressed out. So for healthcare workers specifically, self-care is one of the number one things that they can do to reduce their own stress. So the VA endorses this in their informational page, Managing Healthcare Workers' Stress Associated with COVID-19 Virus Outbreak, which was published on March 9th, 2020. They state a self-care strategy should be multifaceted and phased properly to support the sense of control and contribution of healthcare providers without making them feel unrealistically responsible for the lives of their patients. So they list a couple different ways to reduce stress, which is taking time out to have basic bodily functions, make sure you eat, make sure you use the bathroom when you need to, make sure you keep refreshed, keep your anxiety conscribed to actual threats. So try not to worry about things that you can't change, and try to talk to yourself with helpful self-talk. I can do this, I've got this. And there are some stress specific ways to reduce stress for the public. The CDC, on their informational page about stress and coping, entitled Stress and Coping, which was published April 1st, 2020, they recommend making time to unwind, limiting the amount of time spent watching news coverage of COVID-19. Like we discussed earlier, it's very discouraging when all you're seeing on the news is deaths about COVID-19 and worrying about COVID-19. And checking in with loved ones as a way to cope with the new guidelines during quarantine. The CDC also recommends reading literature and they provide links about coping with traumatic events and pandemics. So occupying the mind with new hobbies that can be done at home might be helpful to distract from feelings of anxiousness or being overwhelmed with the news. Definitely, I think one of the most important ways to reduce stress and anxiety and mental health issues would be to disconnect every once in a while, especially with the way that the media is portraying COVID-19 right now. If you're safe, you're at home, there's no need to stay connected to the news outlets 24/7. So to conclude my speech, I'd like to restate that COVID-19 can and likely will affect the mental health of healthcare workers and the general populace, but there are many actions we can take to reduce our stress and anxiety and worry and fear about this condition. So healthcare workers, they encounter increased stress due to the need to wear PPE constantly, risk of transmission, and stigma. The general population will likely experience fear or guilt, increased suicide risk, and a risk of altered societal norms. Despite the many conditions under which all individuals might encounter the stress, during this pandemic, there are a myriad of ways to combat these distressing feelings. Keep healthy in general, eat, work out, get enough sleep, drink your fluids, find hobbies that are pastimes, maybe even new pastimes you never had before that can help you distract from the times, and definitely the news, the COVID-19 related news outlets. Negative emotions and stress can come from stuff like that, so it's very important to keep yourself not distracted completely, stay updated, but disconnect every once in a while. Take good self. Definitely, I think in times like these, one of the number one things that can help you personally is to find out what works for you. Find out what your coping strategies are and make time out of each day to do them. Whether that's self-care, finding a new hobby, playing with your dogs, going outside for a couple minutes every day. Find what works for you, and remember, it's not going to last forever. Thank you.